Reported cases of COVID-19 has passed the 10 million mark today. This is the number of global deaths from the virus approaches 500,000. The grim milestone comes as many hard-hit countries ease their lockdown measures whilst making extensive alterations to the way people live and work. North America, Latin America and Europe each account for around 25% of cases, whilst Asia and the Middle East have around 11% and 9% respectively. Just two countries, India and Brazil, account for over a third of all new cases reported in the past week. They're both battling outbreaks of over 10,000 cases per day. Brazil reported a record 54,700 new cases on June the 19th. Some researchers are predicting the death toll in Latin America could rise to over 380,000 by October. Now, as of this morning, there were nearly 500,000 or 497,000 fatalities linked to COVID-19 worldwide. Some countries are also experiencing a resurgence in infections, leading authorities to partially reinstate lockdown measures. The United States saw cases pass the 2.5 million mark yesterday. Countries including China, New Zealand and Australia have seen new outbreaks in the past month, despite largely quashing local transmissions. Well, let's focus now on the United States, where hospitals in several states are admitting patients in record numbers as new infections continue to skyrocket in the Sunbelt states across the south of the country. From Florida in the east to California in the west, those southern states are driving the record daily numbers the U.S. has experienced over this past week, with some 43,000 new cases over the last 24 hours, surpassing records reached during the first peak back in April. This was the country's health secretary speaking earlier on NBC Meet the Press.
The window is closing. We have to act, and people as individuals have to act responsibly. We need to social distance. We need to wear our face coverings if we're in settings where we can't social distance, particularly in these hot zones.
All right, for more on this, we're joined by our U.S. correspondent, Sherwin Bryce Pease. Thank you for being with us, Sherwin. As always, the U.S., where you are, appearing to go backwards. And tell us more about this epicenter shifting from the New York region way down south.
Well, we're simply just not talking much about New York City in terms of coronavirus in the United States anymore. The focus is in places like Florida, in Texas, in Arizona, in Georgia, and in California, that you're seeing multiple thousands of new cases every day. And just to point to what Alex Azar, the health secretary, is talking there about, he was talking about the window of opportunity closing. It's similar language that Dr. Tedros Ghebreyesus, the WHO Director General, used in February when warning countries of what was to come. The window was closing then. How can it possibly still be closing some 4 months later? And I think that really speaks to where we are in the United States. This is really about the intersection between politics and science. The notion that we are still debating in the United States whether masks are a good idea or not. You have a White House that is not implementing its own federal guidelines. So it's a case of do as we say, but not as we do. If you take an example of the president's rally, that indoor rally in Tulsa, Oklahoma last weekend, where dozens of Secret Service agents, Francis, have had to self-quarantine after two of their colleagues and multiple staff members of the Trump and Pence campaign were infected by coronavirus. So I think that really speaks to what we are seeing here. You will remember back in March, Governor Andrew Cuomo, for example, the governors in the East Coast, Connecticut, New Jersey, were saying, hey, to the rest of the country, this is coming your way. Don't wait for it to come. Use this time to mitigate. And unfortunately, what we've seen very early openings before the federal guidelines were met. And now you're seeing a surge in those southern states, as you well point out, Francis.
Yeah. Well, national leadership counts. So does leadership at a state level. And you were talking about New York, a very different picture, making different records now as hospitalizations reach some of the lowest levels since the start of this pandemic. What's the latest?
Yeah, you also had a conversation with Wilmot James earlier, and he was talking about the fact that officials in this country from the federal to the state level are not on the same page, often working against each other. And New York has achieved success despite the lack of leadership, if you will, from the federal government. Let's listen to what Andrew Cuomo, the governor of the state, had to say on NBC's Meet the Press earlier, Francis.
This is a virus. It doesn't respond to politics. You can't tweet at it. You have to treat it. And we never did that. Now my fear is we had today 5 deaths. Now, we offer thoughts and prayers to every death in our state, but 5 deaths is the lowest number we have had since this started, Chuck. We are on the exact opposite end. We have less than 800 people in hospitals. Lowest number basically since we started. How does that number go up? 2 ways. Lack of compliance, and I'm diligent about staying after New Yorkers and local governments that have to police it. And second, I'm now afraid of the spread coming from other states because we are one country and people travel, and I'm afraid the infection rate in the other states will come back to New York and raise that rate again.
So what did New York do correctly? They followed the federal guidelines that said you need to see a 2-week downward trajectory in the number of hospitalizations, a downward trajectory in the need for ICU beds, a downward trajectory in the number of new infections, in addition to surging your contact tracing and surveillance capacity. That's what New York did well. That's why the peak in New York of 18,697 hospitalizations in April, Francis, is now down to around 800. So very much a best case scenario. The governor in that interview also talking about the fact that his team has reached out to places like Florida and Texas to say, this is what we did right. This is the blueprint to follow.
Yeah. And right now, I mean, if we go back to this resurgence in some of the states, having enough hospital beds, ICU capacity, those are big issues. Are there enough beds in the states that are in the middle of a surge right now?
If you remember at the height of this pandemic in New York City, where you had these 18,000 hospitalizations and numbers that were spiraling by the thousands every day, there was a need for expanding the hospital system's bed capacity. You saw the Comfort Navy ship arriving New York Harbor with an extra 1,000 bed capacity. You saw a similar bed capacity at the Javits Convention Center here in Manhattan. But fortunately, the peak was of such a nature that they didn't actually need to use that capacity. And so that hospital ship has left the city, a similar hospital ship has left Los Angeles, and that temporary hospital, that field hospital, has been shut down. But the equipment that was brought here by the Army Corps of Engineers remains in New York in case of a second surge. And what we are seeing in those southern belt states is a different surge to what you saw in New York. They have had the last 4 months to build their capacity. So when you talk about a place like Houston, Texas, where you saw reports earlier this week that they had reached 97% of their ICU bed capacity, that hospital system is a really good example. In turn, they are saying that they do have capacity on the sides. They will convert convention center, they will convert sports grounds if needed. So they have used the time to prepare for what might or might not have come. And now, as you're seeing the surge here, they are better prepared than what New York or Connecticut or New Jersey might have been in March or April of this year.
Well, finally, what then do they do? Because they want to open up economically, but we're hearing some of the states are saying, well, hold on, do we open up fully? Is there a sense of a little bit of limbo?
Well, we know what to do, right? The federal guidelines are there, and they warned, the Anthony Fauci's of this world warned back in March or April when these guidelines came out to say, if you are going to enter into a phase 1 reopening and you then see a surge in cases and a surge in hospitalization, there will then be a need to move back from phase 1 to phase 0. And I think you're seeing iterations of this in places like Texas, where the bars now have been closed. No alcohol is being served in those bars because young people in particular have been going to these places not wearing masks, not social distancing, and that's why you're seeing a spike there. They've made a similar decision to close down bars in Florida as well, and you can understand the frustration from business owners that have for months been waiting for the reopenings to happen, only within weeks to be told that they have to shut down again. So there's an economic question that needs to be dealt with here, but the public health emergency that is dominating any economic decisions here, because we are talking about life and death in terms of the US population.
Such difficult decisions which we face here in South Africa. Yeah, thank you so much for your time, our US correspondent Sherwin Bryce Pease. Now, closer to